really helpful, I think, for patients to understand that there are many different ways that skin cancers on the face can be treated and reconstructed. One of the original ways to do this was to mark out an area around the specific lesion on the patient's face. And in some cases it would be 2 millimeters, in some cases it would be 5, and maybe up to a centimeter of diameter around the lesion itself. Remove it, and then over a series of days and pathology testing, determine whether the entire cancer was removed or if more tissue needed to be removed. And then there's also another option called Mohs surgery, and that's actually named after the person who developed the procedure. And dermatologists most often will undergo a special fellowship training to become Mohs dermatologists. At that time, what they'll do is remove the skin cancer, but look at 100% of the margins at that very moment. And if they feel like there's more, if they notice that there's more disease present, they'll be able to treat it at the time. The benefit to that, especially for the face, is that in many cases it will give us a little bit less of a wound size, because they're very specifically only removing areas that have active cancer and not just kind of making an assumption that the wound will be a certain size. So it can be really helpful, especially on the face where we're really wanting to preserve as much tissue as possible. The other benefit is that when the patients come to me with a wound, say on their nose or on their cheek, I know that there's no cancer there. There are other times where we will remove a cancer in a more traditional way, and we're not totally sure if the margins will come back clear of disease. So this is a way to be a little bit more sure, which is helpful both for the patients and myself as the surgeon. And the benefit to that, in my mind, is that you really have two different people focusing on two very important parts of that patient's care. One is a person who is really focused on making sure that the cancer is completely removed without having concern about the reconstruction. So you know that their priority is to remove the cancer. And the other person, who doesn't have to worry about whether or not there's disease present, can fully focus their attention on making sure the closure is as good as possible and results in the best possible scar outcome. In most cases, luckily, these are shorter recoveries. We're talking 7 to 10 days, making sure we get the stitches out, making sure that the wound is healing well. Certainly in other cases, we do larger reconstructions that might involve an up to 2-week recovery, but that tends to be an exception rather than the rule.